Hi, my name is Madison Albornoz, and I am going to talk to you guys about the healthcare professional interview that I did. The healthcare professional that I interviewed is named Stefan Lawson. He is the executive director of the Free Medical Clinic here in Winchester. The Free Medical Clinic is considered a primary care center. It serves specifically the uninsured and impoverished of Winchester, Frederick, and Clark County. Now, just a bit of background on Stefan. He grew up in England, where he got his first degree and his master's as well. He moved to Mozambique and did some relief work and missionary work there, then moved to South Africa with his family and continued to do work in the global health context. Stefan chose to come and work at the Free Medical Clinic because he enjoyed his work in global health, and he decided that the needs that he was seeing at a global level exist in every country, and that poverty and problems with women's health and children's health exist in all low income areas. So he wanted to come to Winchester and help as best he could with the knowledge that he obtained while working in Africa. I'm now going to walk you guys through some more information about the Free Medical Clinic in general. Like I said, it provides primary care, behavioral health, women's health, orthopedics, physical therapy, and there's a pharmacy on site. So the Free Medical Clinic covers a variety of different healthcare options. Not only does the Free Medical Clinic offer all of the aforementioned services for free, but they can also make referrals to over 70 physicians, also for free. All of the lab and diagnostic tests are done through the Valley Health system. Stefan's role as the executive director of the Free Medical Clinic is just overall leadership on a staff of 23 people. He kind of gives strategic direction and oversees day-to-day operations. So he's responsible for a budget of about $1.6 million annually. Now, during the interview, when I asked Stefan what the missions and the values of the organization were, he kind of laughed because he is not a fan of their current mission statement, which happens to be to provide the gift of health to those in need. He is currently revising it, and him and his team are going to vote on what they believe represents their current missions and values the best, but they don't have a working model of that yet. Now, the Free Medical Clinic is organized like many other businesses would be, so they have their board of directors, their executive director, which would be Stefan, their service line managers, and then the staff underneath that. Because of the small staff and the nature of the work that they are doing, all 23 staff members and Stefan consider themselves one large team, and they work pretty much in tandem, and they make decisions all together. Stefan also expressed that the biggest challenge they're facing right now is the ever-changing health insurance system and the large number of uninsured inhabitants that we have here in Winchester. Now, even with that challenge in place, Stefan says that his team is excellent at responding to change in a positive manner. Working with the clientele that they work with is not necessarily an easy thing to do, so they're used to having to make some pretty last-minute changes and just manage scarce resources with community-based health, especially in the sector of free community-based health. You're forced to deal with change quite often. Stefan personally deals with this within his own staff with just mass amounts of education and making sure his staff understands the people that they're serving and why they're serving them. He says that they have had to make a couple of difficult decisions and drop people from the plan who didn't necessarily fit with the overall values of the organization and who were not willing to change based on current challenges. Stefan also said that the best way to manage change is to make sure that any change that's happening within the organization has been agreed upon by the mass amount of the organization, or that his staff and the physicians and nurses, the pharmacists that he works with, that they all agree on the changes that are being made, or that they actually get to draft out the changes that they want to see happen and have everyone else vote on them. So it's very just team-esque, everyone contributes environment. The best way that Stefan has found to keep spirits high among his staff are to celebrate birthdays and other holidays, and also when it's financially appropriate and financially possible, they will award annual performance bonuses. So not only is this kind of a way to make your staff feel noticed and recognized because you're celebrating their birthday, but you're also celebrating the positive impact that they're having on the company by giving performance-based bonuses. What Stefan considers high performance is being able to move with the changes that are being made in the community and provide high quality healthcare to a growing population that needs its services. So the only way that they can keep up this high performance is by one, knowing the community need, two, keeping the staff efficient, three, having innovative solutions, four, finding sufficient funding, and five, having high consumer satisfaction. Now, I do know Stefan personally outside of this interview. That's how I was able to get the interview. We talked extensively on his work in the developing countries that he was working in Africa, because that is what I want to do with my public health degree. So, talking to him in this capacity about his current work in Winchester was very interesting for me, seeing the way that he uses his own morals and values and instills a good ethical code for his company was really incredible. Talking to this guy on the street, you might not necessarily know what he does for a living. He doesn't try to rub his knowledge in your face or anything like that, but he does have a very high level of professionalism, and he's able to treat the lower income clientele that he does come in contact with immense amounts of respect, and that overall just really increases patient satisfaction. Not only does it increase patient satisfaction, but it really gives his employees a great model to work off of as they're working with clients they may not have worked with before. I could have gone and interviewed with any number of healthcare professionals, but as a public health major, it was really important for me to go out in the community and find somebody who is currently living and working in the environment that I want to one day be living and working in. So, seeing the success that Stefan has had while maintaining an incredible ethical code and doing all of the good that he can in the world is really inspiring for me as a prospective global health worker. Taking this class, I'd begin to have some thoughts of inadequacy. Maybe I had made the wrong decision in changing my major from healthcare management to public health. The more and more we talked about companies and hospitals and how they run, the more I thought that business might be the right side of the equation to be on in the situation. But talking to Stefan and just learning all about his history and his past and how his experiences in global health and public health have really helped him to be able to assume this executive role was very inspiring for me, and it really put some fresh hope and some fresh passion behind my pursuit of a career in public health. Thank you so much for listening to me. I really appreciate it. I would encourage you, if you have any kind of medical background or really any way that you think that you could help, to go and try to volunteer at the free medical clinic. Just do all that you can there. They serve so many people in the Winchester community. And if not the free medical clinic, there are a lot of other ways to get involved around here that I would love to talk to you all about in person. If you want to know, I work extensively with both the youth and the adult population of impoverished people here in Winchester. So thank you once again, and I hope you have a fantastic Thanksgiving break or winter break whenever you happen to see this video.